Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, and welcome to the Paramena Bliss Podcast, brought to you by perimenobliss.com and ablehealth.us. Today, I want to talk about, on the drive to work, we're going to discuss hot flashes in your 40s. And you might say, well, what's the difference between hot flashes in your 40s and hot flashes in your 50s? And the answer is actually quite a bit, because hot flashes in your 50s is a little bit more cut and dry. We know at that point the estrogen levels have dropped, and in terms of correcting it, it's straightforward. We just slightly adjust your bioidentical hormone cream to include small amounts of bioidentical estrogen, usually in a form called Bi-Est, which is a mixture of E2 and E3, and perfect, you're done. However, in your 40s, there's a few more nuances that could be occurring that I want to discuss. So, because mainstream treatment, what you're going to get is that they don't really care how old you are or what's happening. If you're getting hot flashes, you're probably going to get an off-label prescription for an antidepressant, because sometimes they have been shown to reduce hot flashes a little bit. But to use an antidepressant off-label for that purpose, especially with all the side effects associated with them, to me is just a terrible decision. So let's discuss the actual root of the problem and how do we address it. So normally what you can do is that you test your hormones during the times when you're getting hot flashes. Because when you're getting hot flashes in your 40s, it's not usually that you're getting them all the time. They're coming in waves. Like, they might just be during the end of your cycle. Or if your cycle's starting to change and it's not as consistent, maybe you'll get hot flashes for a couple weeks, and then all of a sudden they just go away for a few months. So you want to kind of do some of the testing during that time. And that's why we get to look at your hormones during that time when you're getting those symptoms. Because what it's going to come down to from an estrogen standpoint is your estrogen drop too low at that point? Or are we dealing with something where I would consider it to be relatively low? Because hot flashes occur as the hormones drop relative to what your normal was. And this is the part where the testing becomes a little bit more difficult, because what happens is that when you're testing the 50s, it's just bottomed out low. Like, it's clear as day. We know. In the 40s, though, sometimes, say your estrogen tested at, something like 200, and that's like, well, that seems pretty good. But maybe your normal at that time before was a 400, so really it's dropped 50%. That drop relative to compared to what your levels used to be, when it drops too low, that's when you start seeing symptoms like hot flashes flare up. Now, at the same time, there's other times where the estrogen seems to be completely normal, and it's just, for some people, just a drop in their progesterone during that phase of each month can also trigger hot flashes. So test first and find out what's going on. Then we determine, is it low or is it relatively low, or are we going to start with progesterone first? Now, if the progesterone is found to be low, it's very normal that we would start by using a low-dose progesterone only, no estrogen, especially in the 40s, and especially if you're still getting a regular cycle. And then to help with some of the symptoms, you can use some diet changes and herbal formulas. That would be step one. So balanced progesterone, herbal formulas, and diet changes. The diet changes would typically look like pulling back on caffeine, pulling back on too much sugar, and then pulling back on wine. Alcohol will really kind of throw off the hot flashes quite a bit. The herbal formulas, there's a huge variety. The classic stuff you'll see at the health food store, which I've never really found to be that helpful, is they'll give you like black cohosh or sage tea. And while have used those in formulas, I would never use them as standalones because I've just never found them to be that great. I would like to use herbs that are more of a Chinese basis, and from that aspect, they use things that help clear heat and helped support yin, which I've discussed more in a previous podcast, so I'm not going to dive into yin and yang too much right now. But this would be herbs like Dong Quai, Scutellaria bicalensis, Alchemilla, those types of herbs. So we have all those things combined in our Hot Flash Results formula. So if you want to learn more about that, you can just go on to perimentalbliss.com or ablehealth.us. So herbs and diet, and then starting with the progesterone. Now, if that's not enough, and we found out that you're still getting symptoms, and if the levels were low end but not totally bottomed out, then we would consider adding a very low dose. You pull back on the herbs because you don't want to just keep adding things, to be honest. So in this situation, you're trying to replace things. So you'd pull back on the herbs and use a low dose biased cream or a low dose estrogen cream in combination with the progesterone. So it goes back to a one prescription combo cream just to simplify things, because I don't know, personally I think taking too many supplements all the time is a bit of a pain. It's too expensive, it's too many pills to swallow, too many creams to use. So any chance that we can put things together in combinations to get results, it just makes it so much easier for the person to do it. And if they can do it, they're going to get the results. Otherwise, they just get frustrated and quit. So I hope this gives you a little bit of information about how you can deal with hot flashes in your 40s versus when in your 50s. Because again, it's not always the exact same cut and dry solution. But this should give you some answers and some ideas that you can start using in your own life if that's something you're struggling with. So this is Doc Yates, signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit perimentalbliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.